So my name is Justin Klotz. I'm doing my presentation on PRP, or platelet-rich plasmas. So here's some applications and some information on PRP. Platelet-rich plasmas are just a portion of the patient's blood having a high concentration of platelets. It can be used to promote the healing of injured tendons, ligaments, or areas of the body that are not vascularized well. Because the substance is injected in areas that are not well vascularized, like tendons, it can deliver the healing instincts of platelets without causing the clotting response you probably know platelets for. So platelets are a hemostatic sealant. They are a scaffold for tissue regeneration, and growth factors increase linearly with platelets, and with those growth factors also come stem cells. So here are some boring growth factors that are associated with PRP. You have platelet-derived growth factor, and they are chemoattractive for white blood cells and mesenchymal stem cells. You have transforming growth factor beta, which promotes cell mitosis and significantly increases type 1 collagen production in tendon sheath fibroblasts. And then you have vascular endothelial growth factor, and it stimulates angiogenesis, which is just blood vessel formation. So common methods of PRP preparation: you would withdraw 55 cc's of peripheral blood, centrifuge it for 15 minutes at 3,200 RPMs. You would remove the platelet poor plasma, and I'll show you what that looks like in the next image. And you would shake it vigorously for 30 seconds. So here's what it looks like. There's some taking the peripheral blood, and then in the second platelets, and here on the third portion, that top yellow, that's the platelet poor plasma, and the orangish color, that's the platelet-rich plasmas. That's what they want. And then you would use preferably ultrasound to inject the PRP to the site. And this is actually a new system. It's called Arthrex double syringe system, and basically it keeps the PRP process in a closed system throughout the procedure. And the centrifuge time that they use is for a less amount of time. And apparently, the research that I've read, the amount of platelet-rich plasmas that they get from their centrifuge process is 2 to 3 more times than common methods. And they also, since there's less centrifuge time, the top section, the ACDA, that's used to drive down the pH of the blood once it's taken out of the body. If you centrifuge, if the whole process takes less than 30 minutes, then you don't have to use that ACDA, because it actually dilutes the blood, or your PRP. And so what are the benefits of using PRP? It can be an alternative to surgery in certain cases. On average, it's $2,000 compared to $10,000 to $15,000 for surgery, and also injection carries far less chance of infection than incisions. Research regarding PRP is limited at this time, and results are inconsistent. Presently, PRP use in tendon and ligament injuries has several potential advantages, including faster recovery and possibly a reduction in reoccurrence with no adverse reactions described. The promise is there, but more research is needed. And I thought this was interesting. In the Super Bowl in 2008, there were actually 2 Steelers athletes that used PRP before participating in the Super Bowl. Troy Polamalu used PRP to treat a strained calf, and he says that it tremendously helped his performance. It's just his personal say on the subject. And Hines Ward used PRP to treat a MCL tear with other rehab interventions, but he says without that he would not have been able to play. So in summary, by taking advantage of the biology behind platelets and using high concentrations of it, PRP, we could find an alternative to surgery in some cases. Much more research needs to be done before PRP becomes more of a common use for injuries. As an athletic trainer and clinician, we are not able to heal someone's body. We are able to create an optimal healing environment, and PRP falls in line with that principle. And that is it.